Okay, good afternoon and good morning, everyone. We're really delighted to be holding this virtual workshop with you all. We've got a group of panelists and a long list of people who have dialed into this. And we have to say it's something of an experiment, so bear with us. But the idea is to try and have a conversation together with groups of researchers and health workers from across the globe, just to try and begin a conversation about how we might support the research implementation efforts. And particularly, we're focusing on the work that's already been put in place by WHO and ISARIC. And so we're really keen to hear from everybody about what you're thinking about, what do you think the research priorities are, where you're beginning to get some activities going around this, and maybe hear where the gaps and questions are. So in a second, I'll hand over to our panelists, but then we hope to give most of our time to having open discussions and Q&A. And so for this, if you look on your screen and you look at the dashboard you have for the Zoom call, you can see the chat boxes and it says Q&A. If you write on, you can start doing this now because the team can start collating them. Do put down any discussions points you'd like to raise or areas you think would be really important for this, these questions as they evolve and when you listen to the panelists. We won't have time to talk through all of them today, but we're going to gather them together. We also ran an identical session to this morning, which we had loads of wonderful ideas and topics came through, and we're going to collate all of those. This call was also completely oversubscribed, so we've emailed everybody who couldn't come and asked them to contribute as well. And we will be collating those together and trying to keep this going with more workshops like this and some open forums as well. So thank you very much for joining us. We shall get cracking now, and I'm going to introduce you to the panelists. These are researchers from around the globe who are really beginning to get underway with some thinking around this, and they're just going to share with you their situation, and then we'll move on to having an open discussion. We're also really lucky this afternoon. We've got Nikki Shindo with us from WHO, and also the ISARIC team are with us, and they're going to just talk us through some of their tools and resources. So I will hand over, first of all, to Jacqueline, who joins us from Honduras. So Jacqueline, I'm going to stop sharing my screen and I'm going to pass over to you. So thank you very much for agreeing to do this, and we're really looking forward to hearing from Honduras.
So this is Macete just joining the meeting.
Silvia, brilliant. That's fantastic. If you can stand by, I'll just talk to you on the chat and we'll hear from you in a second. Really great, especially we've got Pia Cruz on here as well, so excellent to be joining Mozambique. I'm just going to talk to you on the chat, if you can put your mic on mute, but thank you for joining. Jacqueline, over to you.
Thank you very much. With this participation, I will share with you some information about the Central America and the Caribbean region on the actual COVID-19 situation, research preparedness, some topics of interest expressed by research groups, and at the end, we will reflect on what can be done. Here we see the WHO map updated as yesterday, March 12, and we can see that 6 countries from our sub-region, Central American and Caribbean, have already reported cases, and it's just a matter of time that a new country from the region will also report cases. And then how is the response to this pandemic in our region? Well, first, I would like to reflect that the response had been influenced by recent experience, such as the Zika epidemics in 2016. Then we have the global and regional responses. We have the experiences shared by countries with similar or different characteristics. Also the availability of international guidelines, but of local relevance, it's important to remark the influence by the existence or not of a National Institute of Health or Public Health, also the existence of a health system with access to resources and procedures described in the guidelines, and also the role of the mass media and social media locally. And then the perception of the response also has influences. It had been influenced by the lack of credibility, accountability, transparency on the health system. For instance, here there is a wide variety within the countries, within the region. I'm mainly going to talk as a personal perception and my experience in Honduras, but this response had been perceived as belated, fragmented, inadequate, disproportionate in some aspects, contradictory in some aspects, and I want to remark the lack of local research. Then in regard to the research preparedness, here again, there is a variety of situations within the regions. But in general, I can say that there is a limited research, legal framework and regulations. There is insufficient research infrastructure, also lack of access to competitive funding, scarce research group, and there is a lack of incentives. And then in regard to the perception on gaps, I can appreciate gaps on effective planning and evaluation on biomedical research projects. Also gaps on research ethics training and capacity for ethical evaluation and approval. Gaps on research methodology and design, and importantly, gaps on biostatistics and epidemiologic analysis. In regard to the perception on research priorities, well, I can appreciate the necessity of research studies on priority topics of prevention, diagnosis, treatment, and also health system bottlenecks and solutions for these bottlenecks for scaling up the responses, and also social behavior. In regard to the perception on barriers, I can appreciate that importantly, research is not perceived as contributing to the solution. Research is perceived as a luxury. Also, there is a lack of leadership and teamwork, inadequate institutional infrastructure and support, deficiency in training, and lack of sustainable resources and funding. I also wanted to share with you some examples of topics of interest expressed upon contact for this virtual workshop with some research groups, colleagues from the region, and this happened in the last few days. Then colleagues from Guatemala, El Salvador, Dominican Republic, and Honduras, all of them express interest, all of them express COVID-19 as a research topic of interest, but there were dilemmas, or there were situations and of lack of opportunities or searching of opportunities. But the main theme here is that COVID-19 is appreciated of a research topic of interest. Then what can be done? Well, we could look for opportunities to work globally in partnership to build capacity and face these unknown and rapidly evolving situations. We can identify systematically faulty steps in the research process map to be addressed and corrected or improved and strengthened, gaining time and saving resources by developing adapting tools based on tools already developed. We could identify national research priority according to national health priorities and a strengthening of national health research systems, that is, that research can be appreciated as part of the solution. Okay, then here I'm going to stop sharing the...
Thank you very much. That is absolutely brilliant. Thank you so much for that. We will hold questions into the end because we'll have we'll make sure that we have time for this wider discussion as possible. So I will hand over to Flavia actually from Brazil, if that's okay to move to Flavia. Sorry, it says Esther. If that's, Alex, are you helping her share her slides? I'll stop mine so we can put those up.
Yeah, no, Flavia, you should be able to share your screen now.
Thank you for everybody that's joined the call. Just to point out while we're letting Flavia set up, if there's a few features you can use on here, you can put questions into the Q&A so that we have some ready for the discussion. Feel free just to add discussion points, ask questions from the panelists, because we're going to leave a good half an hour to have some really comprehensive discussion. So hopefully Flavia's, there we go, well done. I'll hand over to you, Flavia. Thank you.
Sorry, are you listening?
Yes, we got you. Yeah.
Yeah. Okay. Sorry. So can you see my screen? Yeah.
Yeah. Great.
Thank you so much. Yeah. Sure. Thank you so much for the invitation to speak. So I'm just, we now have in South America 8 independent countries with coronavirus already, and French Guiana as well. And well, as you can see, like Brazil has now around 85 cases, and this is not updated because there is a lapse of time between when the website for the Ministry of Health just update the cases every day. So so the most cases we can find in Brazil, Chile, Panama, Costa Rica, as Jacqueline just said. And well, on the Brazilian response, I can highlight some initiatives that the Brazilian government has been taking since the beginning of the epidemic in China. So even though we didn't have any cases, which we started preparing here for the possible arrival of coronavirus. So initially we established a national emergency for administrative purposes, which was to pass a quarantine law in the Congress. We did that in a very, very quick time. We did that in 2 days. We passed through the two Congress houses. And so this was very important to regulate what we were doing to people with coronavirus, and especially people who wanted to come back from Wuhan to Brazil. So we actually brought around 30 people from China to Brazil, and they stayed in a special place in Goiás, in the state of Goiás, in a quarantine there. So, and then we established, of course, our committee of emergencies, and we established contingency measures. So yet we are in the first phase of the epidemics here in Brazil. So we are trying to contain the virus. And so we are actually passing through from the first case to the second phase of this epidemics here. And so I think more strong measures are going to be taken in the next days. We are actually advancing the flu campaign, because we are not yet in the in the winter here. But we're going to vaccinate people. I think it's still in this month of March. We're establishing patient referral flows and actually preparing our health system to increase the number of hospital beds and respirators as well. So we can provide assistance for people who have like a more of a strong coronavirus infection. Fiocruz is having a key role in these epidemics as we are the referral institution, and in our hub in the Global Health Network we have a special page on the coronavirus response of Fiocruz, and we are actually training everyone in the every laboratory in Brazil to test for coronavirus, and we also train like 9 Latin American countries as well for that. We actually established a situation room that meets every week to organize everything we are doing with the Minister of Health, because we are working closely with them, and we are actually producing the test kits and redistributing all over Brazil. So right now, the research priority here at Fiocruz, one of the top ones, is the production of those kits that could test multiple viruses at the same time for a differential diagnosis. So we don't waste so much time like testing for so many viruses. And well, I think that's about it. Thank you.
That is wonderful. Thank you very much for that overview. Now, the good news here, we've been joined by Asubio and Pacifique, so we've got 2 African countries to hear from briefly. Asubio, can I hand to you first, if you're ready? So if you can stop sharing, well done. Asubio, I don't know if you've got any slides, but no matter, we can just hear from you, which would be wonderful to hear from Mozambique. Over.
No, thank you very much. So
that's lovely, and hear you loud and clear. So looking forward to hearing.
Sorry?
We can see your slides and hear you loud and clear. So go ahead. Thank you for joining us.
No, thank you very much. I was saying that for me personally, I want to thank you actually for organizing this call. And also, it's a sad moment because all of us as a country, some people, were very stressed with this pandemic. But we also have an obligation to give a response and help those who are not much informed and those who need help. Second, saying that I'm based in Africa and in Mozambique. As you know, we're not sure whether the silence notification of African continent, is it really true or not? Are there cases which are not yet notified, and because of lack of the diagnostic capacity, or it's really precise information which is reflecting what's going on in Africa. So within African continent, we have almost now around 50 cases, according to the last report from WHO. Those cases are reported in some countries in the north, West Africa, west side of the continent, and then we have South Africa also in. But even for us as a part of those countries which are not yet part of the notifying countries, we're still very worried for the situation. So the countries are taking the international measurement and means, so controlling the borders and controlling those who are coming from the exposed countries, keeping them in quarantine. So Mozambique is one of those countries where officially the government has already announced to organize a quarantine program for travelers who are coming from those exposed countries. Initially, it was only for China. Now It includes also those countries which have more than 1,000 cases already notified. And second, there's a provision of space for isolation. So far we have one hospital which has been arranged for just in case of the initial case to be diagnosed and to be allocated there, and human capacity also in place. There was initially concern regarding the availability of the primers or kits for the diagnostic, for the PCR. It looks like through the support from WHO, in most cases we have already in the country around 2,000 kits for diagnostics. But this is what's going on in the country. But at the regional level, I think we are having now different discussions to see, because if you having an epidemic like this in Europe and Asia, probably Latin America, probably could be slightly different what could be happen in Africa. So in Africa, you still having places which are still very heavy malaria burden of disease. We have places where we're still having very heavy diarrhea, like cholera disease. So we don't know yet how will be the interaction between those diseases. So this is an ongoing discussion. We have to see. But here, I think we probably at regional level we minimize or probably we overestimate the capacity of the National Institutes of Health. As you know, most of those tasks at the research level has been allocated to the National Institute of Health. Even if you go and see the approach of African CDC is mostly to reinforce the National Institute of Health. But within the countries, those institutes are not alone, and those institutes have, in most of the cases, they have no capacity to cover the entire country. So what we probably at this stage, before to have the huge problem in place in the table, we need to think about which other institution could be also be part of the game and see the delegation of the work, and also to have a complementarity within the countries. In our case, we had already the conversation with the National Institute of Health, Manisa as a lab capacity. We have a PCR capacity. We have a BCL3 capacity. So we think that probably at some stage, we could act as a backup facility for the National Institute of Health. But this is not a specific situation for Mozambique. I think this could be applied for many other countries. So we are watching carefully what's going on, but still discussion and also measures to be clearly defined, even in a daily management of the patients at the different level of hospitals, which kind of procedures have to be carefully be considered and applicable at the different levels, considering the weakness of the national health system, weakness of the logistic. Most of our countries are really very complex countries, and then we are currently at the end of the rainy season. So it's really a very complex environment, but I think so far countries are doing what they can have done. Thank you.
That's great. Thank you very much, Siba. That's an excellent overview. Can you take off your screen sharing? And Pacific, are you there? It's really kind of you to join us. I know you've had a really busy day out working with your regional hospitals, but very pleased to have you join us. So thank you. Siba, can you click off screen share? That's brilliant. Pacific, have you got any slides? It doesn't matter if not. Just good to hear from you and what your activities are. Just for 5 minutes would be great.
Great. Thank you, Andy. Hi, everybody.
Is that okay now?
Unfortunately, I don't have slides, so I will try to briefly share with you what we are doing.
That's absolutely fine. It's just good to hear from you.
Okay, good. Thank you very much for inviting, and it's really a pleasure to be part of this discussion, of this session. And we appreciate also the initiative from the Global Network. So this is Pacific from Rwanda. I work with what you call Rwanda Biomedical Center. So here in Rwanda, each ministry has an implementing organ. So the Rwanda Biomedical Center is the key implementing organ of the Rwanda Ministry of Health. So we have different divisions, department, programmatic divisions. So we have a division in charge of epidemic surveillance systems, but also we have a division in charge of medical research. Medical research, yes. And I'm from that medical research center. So Rwanda has been proactive and engaged in outbreaks preparedness these last years at all levels since the Ebola outbreak was declared some 2 years ago. So Rwanda has managed to put in place a national preparedness plan, which has a mandate to train health workers for early detection and response, to educate communities about these kind of outbreaks, to equip health facilities, to conduct simulation exercises, to make sure that we maintain a high level of readiness, etc. So for these specific outbreaks, the COVID-19, so the government of Rwanda has put in place the National Steering Committee, which involves different stakeholders to make sure that we have a multi-sectorial team. And we have different levels. So the first level is about the pre-epidemic phase. So for the moment, we don't have any cases reported in Rwanda. And we are still at the first level, the level of pre-epidemic phase. But we have been planning for, of course, in the context, in the regard of preparedness, we have also activities planned in case we arrive on level 2. The level 2 is about sporadic cases, one or a few cases, once we have one or few cases from affected countries. So today we had that in Kenya, we had one case. Some days ago, we had that in Congo. Those are the neighboring countries. In Congo, we have some cases. For Uganda, which is in the north of Rwanda, we don't have yet a case. And in Tanzania, fortunate that we don't have. So this is about the second level. For the third level, it's when you have most cases due to localized transmission in the district, sector, cell, or village. And then the last level is about the community transmission, where we can have outbreaks in more than one cluster with the inability to relate confirmed cases. So if I come back on the first level, we have been having different meetings, different activities are now ongoing, and we have different teams, a team of overall coordination and leadership, communication, public engagement, the surveillance, the public health measures, strengthening the laboratory testing. I forgot to say that in Rwanda Biomedical Center, we also have a national reference lab. So we have been enhancing the capacity for this COVID-19 testing, where we have been procuring some equipment, reagent, training lab technicians, etc. So we also have a team about case management and then logistics and supplies. So briefly, this is how we are being prepared. In terms of research, we have also been, because we are the one conducting or developing the National Health Research Agenda. So now we have been updating very quickly the agenda, making sure that we have also a focus on this kind of outbreaks, starting from Ebola. And now we are thinking, we have been brainstorming about the potential research project we could conduct or implement in case we have Ebola, in case we have COVID-19 outbreaks. So this research, potential research ideas are from the planning phase, the prevention phase, the screening phase, the treatment, and even the follow-up phase. So we have been developing some proposals for this specific research, potential research ideas. And then we are also partnering with different partners, collaborators. We are open for any kind of research project. So briefly, this is what we are doing in Rwanda, and thank you again very much for inviting me during this session.
Thank you very much, Pacifique. That's brilliant. That means we've heard from Mozambique, Rwanda, Kenya, Honduras, Brazil, and Thailand. So I think that's fantastic to have that picture. And I think the way that Rwanda works across all your medical centres is something we should really share broadly. So thank you very much. I'm really pleased we've got Nikki Shindo on the line now from WHO. Nikki, if you could, I know it's an impossible ask, but if you could just give a kind of 5-minute overview of some of the resources that WHO have got. We're sharing these through the chat and online, but I think just the aim here is to use this community of practice to try and help implement some of the tools you've been developing. So just really great to hear from you and see if you've got any ideas that you'd put to this community as well that we can use to really enthuse and engage everybody on this call with the idea of really getting cracking on being ready for research. Over.
Okay, well, thank you very much for having WHO on this call. I'm impressed the number of participants on the call and the breadth of the countries and institutions joining this effort. So from WHO, we seen a lot of changes in the past 2 weeks. And 2 days ago, our Director General described the characteristics of the COVID-19 situation as a pandemic. We had tripled number of countries reporting new cases in the past 2 weeks, and the number of the country reporting to WHO the COVID-19 cases are now 114 countries that represent 2/3 of the global population. And but still, the countries having community transmission, so to say, extensive community transmission only occurring in a handful of countries, and WHO is helping those countries to control, in some instances, to contain the cluster occurring in those hotspots areas. So the one of the reasons that DG announced pandemic, using this term pandemic, is really to alarm the countries that are not ready to receive cases and are not ready to inform the public, and also to have opportunity to train the frontline responders, and also to discuss and decide how to manage in case of surge of severe patients with severe illnesses. So we wanted to use this opportunity with DG declaring pandemic. For us, many of us were aware that this SARS-CoV-2 virus has a pandemic potential, but mainly it was about one big country experiencing a real full-blown epidemic, and other countries receiving some, and then the spillover effect and some intense amplification of super spreading events. But clearly in the past 2 weeks, the situation has changed. And we are seeing some of the countries who are experiencing a large number of cases happening. We see as well the very high case fatality ratio. So if you are not prepared, this virus does really bad things about your community, your people. So this is really alert to every country in the world to get ready to receive. And for those countries which have not been receiving any cases, we still have 42 countries not reporting any cases to ready for the first cases. And I just sent you via chat that WHO's 4C scenarios. The 4Cs are based on our thoughts to help you or countries to plan for different scenarios. No cases, first few cases, and first few clusters, and community transmission. So everyone has to use your imagination and engage your community to develop the best response plans for those 4C. And we have a table to help you to plan for these 4 scenarios. So if you are interested, you can have a look at it and use this tables as your checklist to be better prepared. And research, of course, is challenging, but if you plan ahead, we have seen many countries, including our Chinese colleagues, have done a great job running the research as they respond to the outbreaks and epidemics. So if you're well planned and if you use your experience through major outbreaks like influenza and Zika, I'm sure that you can contribute your effort to build global evidence-based public health policy development. So I'll stop here, and if you have any questions, I can take some. Thank you.
Nikki, that was just fantastic. That was a tall order asking you to do that in such a short time. That was a really lovely summary, and I'm sure you'll get some questions back in the open session shortly. I'll hand quickly over to Louise because it would just be great to hear from ISARIC too. And I know we've just in the resource area, there's a whole list of the ISARIC tools. But Louise, do you want to just give us a quick work through what's available from ISARIC in terms of protocols and tools? Thank you.
Yeah, thank you, Trudy. Can you hear me? Okay.
Yeah, perfectly.
We have some slides. I don't know whether it would be useful to share them. I don't think I can screen share at the moment.
Trudy, if you could unshare your screen.
Sorry, that was me slowing down proceedings. So whilst we're getting set up, just to, we've had lots of questions posted. Keep typing away and popping up your screens as you've got them, because it would be really good to hear either put questions on here or maybe just suggestions you've got or links to work you're doing, because we can collate all of these outside of this if we run out of time today. And it would just be really good to hear of from any of you about your work that you're doing, and any comments that you'd like to post on here. We ran a session this morning, and we had this session just now, and then we hope to run more in the future. So do contribute if you don't get a chance to speak today. Off you go, Louise. That's great.
In my screen. Yeah. Hello, can you hear me still?
Yeah, we can hear you and see fine. If you could go to presentation mode, that'd be fantastic.
Just a quick 5 minutes, if that would be great with your.
Yeah, sorry for that. So yeah, so I'm just going to talk a little bit about the ISARIC focus on the research tool that we have developed to respond to this outbreak in collaboration with WHO and other experts. So most of you are probably aware that ISARIC is a global federation of clinical research network with a mission to provide a coordinated and timely research response to outbreak-prone infectious diseases. So I'll just skip through here. So this is just a map to show the ISARIC member network. So we've got a global reach of members. And so the resources developed in terms to respond to the COVID outbreak are designed to address the most critical public health questions, and they've undergone an extensive review by international clinical experts. The tools are free to use, and we encourage all sites globally to use them. They're free to use, and all sites and users retain ownership and control of the data. But there is the option to do independent study or contribute to combined studies. So for emerging outbreaks, we often need the data from multiple sites globally to enable us to draw conclusive results across demographics. So that's why we're very keen to develop these tools to enable standardized clinical data collections to forward knowledge into COVID-19 to inform clinical management and public health outbreak control. So these are also promoted. So these tools are available on the ISARIC websites. So here are links to the website. And if you want any information about how to use them, we're very happy to help explain how to adopt them locally. And this is also the email address to contact us to if you want to use the electronic database. So the tools comes with case report forms that can be printed off and used as a paper form, or there's access to this free REDCap database. And as I said earlier, the database, the sites retain ownership on the database. So we will not use the data for combined analysis unless sites permit the use for it. So, sorry, yeah. So we can share these slides later, so you can have have a closer look on the slides and keep the links and the contacts. So besides the case report forms, which are set up to collect patient data that can be collected prospectively or retrospectively for suspected or confirmed cases, there's also a clinical characterization protocol, which can be set up to collect patient data and samples. And this is also set up in a flexible way, so it can be adapted to sites depending on the resources. Okay, so the background to these tools, as I mentioned earlier, they have been developed over the years in collaboration with WHO and a range of experts, and they have been used for outbreaks previously. And we have now reviewed and just updated them to make sure that they are set up to collect the data for the COVID-19 outbreak. So besides these tools, and so WHO also promoting these tools on their website, and there's also work ongoing to set up clinical trial protocols, which I believe WHO have more information about on their website as well, if people are interested. So the tools are currently in use. These are a map of the countries that have set up to use the tools and have started to enter patient data. So we're keen to get as many sites as possible set up to use these tools. So just let us know if you want any further information after this workshop. I think that was a quick wrap up. Let me know if you have any questions.
Well done, nicely done. That was an excellent gallop through, and really great to show everybody all the tools that are there, and all the links are being shared, so lots of access to those. Excellent. I think we can go for another, hopefully 20, I'm hoping we can stay on the call for at least 20 minutes. We'll see how we go with questions, because we started a little late to everybody to join. I've been rapidly scribbling down. If you can unshare your screen, Louise, we can just put back up the question outlines. So on the bottom is the Q&A section, and you can see that you can write there any questions. There's a few themes that have come out already, and I wondered if anybody wanted to talk to these. We really want to hear from you. We've got a caller with one of the members of the team here listening in has got a question. I think it's from the vaccine group in Mali. Did you want to? Did you have a comment or a question? We could open up to you first, but everybody else is, please do chip in here, and I can summarise some of the topics that seem to be being called out already. So over to you. I think Alex has to give you the mic. Alex, can you give that first member of the... Hi there, hello. If you could...
How are you?
Very good. If you can just introduce your name and where you come from, and then make
Okay, I'm Sidibe Jakarija. I'm from Mali, working as a medical doctor in the research area center for vaccine development, CBD Mali, which is in collaboration with CBD Baltimore in America. I am very glad to participate to this meeting because as I'm in the research field, last outbreak of Ebola was managed by our boss, Professor Samaso, and he have a city here, center for treatment treatment team, and we had a area isolated from the other patient. As I am wondering if I saw somewhere in Brazil a slide which they raise the number of hospital bed. I think this kind of patient must be isolated from the other, maybe have the special area to keep a patient or contact to follow them beside the other general population. And we manage well with on the responsibility of our boss, Professor Sambaso, and we arrive to manage well and to stop Ebola outbreak. Only 5 or 7 people got this outbreak, and this COVID-19 is more likely transmissible than Ebola because it's through the breathing, through the contact, through the, it's easily reachable to infect the other people, and it is very good experience for me to participate in this meeting. I would like to thank every every participant. Thank you very much.
Well, that was really good of you to introduce yourself and explain, and thank you for outlining the situation in Mali. Okay. I think so. That's great. If you can mute your microphone again, I think I'm going to turn that to Nikki, because I think you were asking around how important it is to isolate in hospitals, and also it's obviously higher transmission rate than Ebola, but lower mortality, I think is the summary. I think I'll turn that to Nikki, and then I think you raised another few questions we can put to the audience as well. Over.
Hi, this is Nikki. So the interesting thing about the corona COVID-19 is a very different pattern of virus shedding comparing to SARS-CoV. So the available evidence suggests that the viral load in upper respiratory tract is very high from a day before to first week of the illness, and then the viral load in both in upper respiratory tract and lower respiratory tract decreases dramatically. So the SARS was only obviously transmissible when patients became very sick. And so it wasn't very difficult to contain this disease. If you are capturing very severe end of clinical presentation in ICUs and hospitals, then you can easily find the patients with SARS coronavirus infection. But for COVID, it's the thing that making this outbreak or epidemic very difficult to contain is that the virus is detectable in very high viral load in upper respiratory tract very early on, almost peaking at the day of onset, and the highest in earlier stage. So let's say from the day of onset to third or fourth days of the diseases, and then decrease. And there are some evidences presented that the virus is detectable a day before, and even -2 day of onset of illness. So we were discussing here to change the surveillance or the contact tracing guidelines to whether go beyond -1 day to include -2 days. So that is a quite serious discussion because it has some resource implications if we go 1 day before. So we didn't really want to miss the core activities happening in the countries, but it is very challenging situation that you have to pick the cases up very early on and isolate them. So as soon as you detect one case, then you really have to look for and identify close contacts. You cannot really give up to spend enough energy and resource to do a proper contact tracing, contact identification, and contact tracing, and convince these contacts to isolate themselves and put them under health observation. So that's really important. But it doesn't have to be in hospital setting. Maybe first few cases you still have capacity to do so, and if you want to use this as an opportunity to test your healthcare system or healthcare facilities, you can hospitalize them and make sure everything including zoning and isolation and frontline workers, infection prevention control measures. We can test them, but if you have a cluster or many patients, then you don't have to hospitalize these patients with mild syndromes or asymptomatic people, and reserve the hospital and your healthcare resources for patients presenting more severe symptoms. I will stop here. I think it was a question for me. Over.
No, thank you, Nikki. That's brilliant. I'm going to move on because we've got another couple of questions and we're running out of time. But I'll come back to some of the points you raised at the end, hopefully. I'd like to pass the microphone, Alex, please, to Bongomin Bodo, who I think has got some interesting experience that they have to share with us. Over.
Yes, good afternoon. Can you hear me?
Yes, we can.
Yeah, please go ahead.
Yeah, my name is Dr. Bongomin Bodo. I work for WHO at the Uganda country office. And I just wanted to share briefly, maybe just to go straight to the area around research. Just a few days ago, maybe just 2 days ago, we with colleagues, as we were preparing for this COVID, doing preparedness for the COVID-19, we managed to sort of adapt some of the guidelines, the global guidelines developed by WHO, but also we have been looking at areas where we could potentially do some research. For example, in terms of triage algorithm, within the health facility for a country like Uganda that sort of doesn't have an outbreak yet. And we've tried to propose one. I have shared the link on the Lancet that was published about 2 days ago. So we intend to test that and see how well it picks up the cases without necessarily overburdening the laboratory system, knowing that the test kits are not adequate. The second issue is around the capacity for advanced care, especially for critical care for patients. Being in a resource-limited setting, we are sort of looking at how do we manage the cases that will come, and around the options. I know invasive ventilation ultimately is what would manage some of the very severe cases, but currently we have very limited capacity. So that's also an area of research that we are looking at. Is there a role of non-invasive ventilation in the management of those patients? And lastly, around some of the therapeutic, we recognize that we have been lucky in a way that we have had a window opportunity that cases have not come. And so we're using this opportunity to prepare some protocols, but maybe some of the therapeutics, although we have none yet within the country. So we're looking at potential collaborators that could have some therapeutics that we could possibly test in the country. But we need to have this sort of protocol developed well in advance before the outbreak comes. So this is briefly what I wanted to share. Thank you.
That's brilliant. And that actually echoes some of the comments that were made this morning, talking about the types of research studies that were needed, which were exactly as you've outlined. Best mechanisms for case detection. Disease characterization came up very strongly this morning as well. What difference is there in presentation in different populations and settings, and then also, as you absolutely said, making sure that the this opportunity of having a window, let's hope you haven't got a huge increase of cases, but you do have a window now to prepare, and therapeutic trials are going to be very important. We are nearly out of time, but I really want to make sure that anybody who's wanted to speak have had a chance to. So if you wanted to click your raise your hand button, now is the time to do it. But even so, we've managed to, there's lots of comments that have come through. Dr. Bogodo, that's brilliant. And we're going to share your links on the forum after this, and we will run some more calls. Does anybody from the panel want to add anything? I think Ken wanted to make a comment about laboratories. So can I just pass the mic to Ken? And then while Ken's speaking, please can, anybody with any further comments to make, please let us know. Ken, let's pass the mic to you.
Thank you very much, Trudy. I am Ken, and Wondo, based in Mombasa, Kenya. I work with the Global Health Network, and my background is laboratory. And we all know that in this COVID-19, laboratory testing is the key to control and prevention. If you don't know that somebody is having the virus, you may not know, or you may not know how to handle it, or how to prevent it, or how to control it. So laboratory is the key, and probably, if I may ask Nikki, we could be having some information. Is there a possibility on the horizon to develop something like a point of care testing, which we can also use at the airport? We can call it point of arrival testing. That could really help on the side of, detecting the people who are coming in instead of using the temperature. Is there any possibility of having that kind of device, Nikki? Hello.
Hi, thank you, Ken. Nikki, do you have any news to share on the development of point of care rapid tests?
So next week we were having a review of, I heard about 48 products, and we'll go evaluates the performances of them. So we should be able to post something on the web very soon, I think. Over.
That's great. Thank you. Ken, that's come up lots of times as well about how care diagnostics in the community is important and is a huge research priority, both in the manufacture and development of these, and then testing and validating them in different settings. I just want to turn the question to one of our colleagues from Brazil. Ricardo has asked a question about how difficult it is to convey the message of risk and any study on behaviour changes. So this is really important, and this we had a social scientist on the panel this morning actually, because we did talk a lot about how running public engagement and community engagement studies alongside disease characterization and trials is just really important. And we've seen with Ebola, and we're learning now that conveying these messages to the public are just critical, and they have to be obviously different studies in different contexts. Does anybody in the attendees, do we have any social scientists that want to pick up that question, or anybody on the panel? But otherwise we can put that onto the forum, because it's a very good call. There was the exact same question this morning. Are there any protocols in existence already for doing social science studies about perceptions and behaviours? So if anybody can answer that now, please do shout, otherwise we'll turn it to the open forum later. I'm just seeing if we've had anybody respond to that. I don't think we've got any more hands up. Okay.
Trudy, this is Jacqueline Alger. I just would like to make a comment on research priorities. I would like to add the health system research, the study of health system bottlenecks, because even if we do have the other procedures and in place, these bottlenecks in countries like Honduras will have a very negative impact. These bottlenecks are from infrastructure to health personnel, behavior, and so on. So I think the health system bottlenecks could be added to the research priority. Thank you.
That's excellent. Thank you very much. Well, I think we should wrap up now so we don't go too much over time. Thank you to everybody for your contributions, especially the panelists and people who have posted questions. We've had lots of questions posted on the system, but also from emails from people. This session was completely oversubscribed, but lots of people wrote in with the points they wanted to make. So we will collect all of those and pull these together from this morning's session as well. And what we want to do is to carry this on and hopefully have some more of these sessions, which we hope you take part in, and tell your colleagues. What would be really helpful to hear from you is what type of topic groups might be useful, because we think maybe smaller really working groups moving forward. And the idea really is to not duplicate at all, but look at what incredible resources ISARIC and WHO are putting out, seeing if there's any different ways that these need to be adapted or implemented in varied settings, and then helping support them with tools for that. But also, we've heard a lot today, health systems, as Jacqueline said, but also social science research might be a complete gap at the moment. So thank you very much, everybody, for contributing. Please, please, please stay involved and tell us what your thoughts are, and also volunteer yourself, please, to really help us take this forward, because this is something that's about having a community response and open virtual working amazing global task force here. So please get involved, and thank you very much for joining today.